um, trying to prevent aspiration on Clarence Henry. So I'm gonna go and introduce myself. Hi Henry, how are you doing today? You doing good? You said did you have a little trouble breathing? Yeah. I'm gonna bring you up to the working height. Can you please state your name and date of birth, Henry? Clarence Henry 3333. Sounds good. So I'm gonna go ahead and sit you up in a high Fowler's. And so it looks like that you had vomited earlier today, and that's what had happened, right? Yeah. So it looks like they got you cleaned up. First thing I'm gonna do is I'm gonna ask you, are you on any blood thinners? No? Are you allergic to latex or anything like that? No? Have you had any oral or nasal surgery recently? No? Okay. The only problem you have today is you're having a little bit of trouble breathing, huh? Okay. I'm gonna go ahead and put this on your finger. This checks your oxygen saturation, just to make sure that everything, his fingers aren't cold. He has capillary refill. I'm gonna put that on his fingers. So I'm gonna go ahead and listen to your lungs and see if there's any liquid in there, because you had a stroke, and that's what we're worried about is aspiration. And aspiration is anything that's going into your lungs and it's not supposed to be in there, like liquid, which is what would have happened with vomiting, okay? Clean. It's gonna be a little bit cold, okay? So it does sound like you have some liquid in your lungs, Henry. We're gonna try to get that fixed, okay? So what we're gonna do is we're gonna start first with we're gonna clear out your mouth, okay? It's called a yonker. I know, it's a silly name. So we're gonna go ahead and we're gonna put this on your chest, just in case we have an accident again. This is my cup. It's an actual cup, so I can test my suction. I'm going to turn the machine on. I'm going to test it. Alright, Henry, this is just going to go in your cheeks, okay? And it looks like that your left side is the one with the stroke, so we're going to get everything all cleared out. Open your mouth. And it's suctioning out. If you have any problem, just let me know. Raise your hand, okay? Go ahead and close your mouth. And I'm making sure not to push in the middle of his mouth for his gag reflex. We wouldn't want him to vomit again. Gonna clear this out. Alright, Clarence, we're just gonna check one more time to see if we're gonna see if this worked, okay? I'm gonna change my clothes if I need to. They're not soiled or okay. Alright, Clarence, I'm gonna go ahead and check your lung sounds again, okay? Clarence, doesn't sound like it worked. We're gonna have to do we're gonna have to use a nasal tube to go ahead and try to get your nasal and oral pharynx, okay? He's not too happy about it, but he knows we gotta do it. So I'm gonna go out, and I grab my package. My package is not open, it's not tampered with. This is a sterile technique. For the video, we are going to pretend that this is also sterile. I'm gonna have enough supplies. That is a new saline. It's not open, it's not tampered with. We're gonna do hand hygiene. Alright, Clarence, are you ready? Not really, but we're gonna go for it. Okay. So what we're gonna do is I'm gonna open this up, and like I said, it's not opened. He hasn't had any surgery, so he doesn't have a deviated septum. There's no trauma, so it should be okay. With this, I can go ahead and touch the outside of the gloves for sterile technique. Put my dominant hand on first. Alright, Clarence, I'm going to go ahead and get ready. This is my little cup to make sure that my suction is working. During this, I've checked his O2 stats and his pulse, and nothing has changed. He is in normal limits. His pulse is at a 70, and his oxygen saturation is at 96, so we're in the clear. I will have to contaminate one of my hands for this. So I'm just getting everything ready before I start. This is going to be my contaminated hand. I didn't cross the sterile field. My back is not turned to this. I go ahead and grab this, turn my machine on, flip this up, put the lubricant on, go ahead and test. It's working. Alright, Clarence, this is going to go into your nose. Make sure you take a breath through your nose, okay? It'll help it get down there better. 1, 2, 3. Go till I feel resistance. I'm on a suction for 10 seconds and then pull it back out slowly, twisting. Alright, Clarence, you did a good job. And then we're going to go down one more time, okay? And hopefully get all the way to the oral pharynx. And a suction. Good job, Clarence. Alright, and then now we can only go 2 times, and I waited a minute in between those. Turn my machine off. Clarence, we're going to check one more time to see if your lungs sound better, okay? Here's a tissue if you would like to clean your nose off. And he cleaned his nose off. Clarence, it looks like we were successful and we got all that liquid out of your lungs. You don't have those sounds anymore. And he said that he feels much better. He can breathe. He's feeling like he should. All right, Clarence, and his all of his stats are reading good. His oxygen saturation is still in normal limits, and so is his pulse. I'm going to document what I did, that he took the procedure well. I will put him back down to a safe level. Clarence, would you like to stay sitting up? He said he would. It's easier for him. That way stuff doesn't run down the back of his throat. I'm going to go ahead and clean up my workstation. Do hand hygiene. Let the doctor, or let him know if anything went wrong, document it all, and I will be done.